Welcome to Heart and Stroke Presents Healthcare Insights During COVID-19, a podcast and YouTube series with leading healthcare experts in cardiac and stroke care. This series brings you the latest updates from the COVID-19 front lines. Leading experts from across Canada share their insights into how systems of care are adapting to the pandemic and how these systems may change in the future. In this video, we are joined by Donna Sharman, a person with lived stroke experience, patient advocate, and peer supporter in the Patient Experience Program at Foothills Hospital. Donna joins us to share her insights on the novel challenges to patient support after stroke in an acute care setting during the COVID-19 pandemic, and the role of virtual patient visits for providing support during this period.
I would like to ask Donna a few questions about engagement and what it's like on the ground, because she does a lot of peer support in acute care at the Foothills Hospital in Alberta, in Calgary, and she does that alongside with her husband. It was once called the Inspires program, now dubbed Patient Experience program. And so she has a lot of insight on what the common challenges are of people with lived experience after stroke, right in the throes of acute care, and what those challenges are. Donna can speak to that. Donna, might you just share a little bit about your lived experience and what initially led you to partner with Heart and Stroke on some of the projects you do?
Well, I had an ischemic stroke in November 2013. And after that, I was asked by Heart and Stroke to do some videos and some different things. Thanks to research, I was able to have an endovascular thrombectomy, so the EVT, and I'm so thankful that was available here in Calgary. So I think that really led to a great outcome. And so I think Heart and Stroke is the place I go to for really good information, and certainly research has to be at the front of everything too. So we've got to keep pushing, and they've made some great advances, but we've just got to keep going.
Yes, EVT and the TPA clot busting medication are quite new when you think of the whole spectrum of care that has happened in the last decade or so. So it's great that you were able to receive the treatment you needed at the time that you did. Can you briefly describe the Inspires program, or what's now called the Patient Experience Peer Support Program at the Foothills Hospital?
Right. So there's about 10 to 12 peer supporters, is what we're called. And we go onto the ward and visit with people. There's two units, the acute ward and kind of a longer rehab ward that we visit. So the program was called, it was Inspires, stood for Inpatient Support Program Inpatient Support Program in Recovery from Stroke. And so that started in 2011, and we've kept this core group of people and that go onto the ward. But just think about it. Can you imagine not being able to go onto the ward now and see people? The doctors and nurses are there, yes. And I mean, they've got their hands full with the COVID and all that going on, but no family members there, no people with the lived experience being able to talk to people. And so that's been really tough, really, really hard to think about that because the doctors and nurses really don't know what it's like to lay in the bed. They don't know that whole piece at all. And so often we see the reactions from people when you walk to the bedside and they think, what? You had a stroke? Come and talk to my friend down the hall here who is here with a stroke, you know? So that's been an amazing, but even though we're not able to be there at this time, our group has maintained Zoom meetings on a weekly basis, and we're trying to keep the momentum going while we try to develop into the virtual patient visits. But it hasn't been easy, and they're trying, and I think we'll probably be back on the ward before we get the full virtual patient visits going. I really do.
Right. I was going to ask how the program is evolved during COVID, and that's been, I can sense, quite a challenge to know that there are people there that are even more in need of talking to somebody, anybody, and having that barrier to being able to offer that support. I've spoken with another colleague of yours in that program, Lori Beaver, and she mentioned that in acute care, often the peer support is more about the listening and less about providing information.
Mhm.
Where do you see the difference in peer support and how that evolves over someone's journey in recovery?
Well, I think it's just that to be able to relate to someone, and just be that sounding board, as you say, with them. And, they'll ask you questions, but sometimes it is that safety to be able to say things or ask things. They really don't know what that future is going to look like at this point, and want to, some of the questions they'll ask you right away are really important to them. So now I'm not sure if that answers totally your question, Moira, there.
Yeah, it sounds kind of like what we're trying with my kids right now. It's inquiry-based learning, and going where the person is at and what their questions are and starting from that point forward. So
Mm-hmm.
that's a really great model. Donna, you've offered insight to Heart and Stroke on several projects now over the years. And what compels you to do this kind of work? What keeps you
Well,
motivated?
yeah, I think it's the reputation that Heart and Stroke has. It's the research that continues on. And, they're the real go-to. I think people know right away to get good information, reliable information. This is where you go. And it's just the people associated with it, the neurologists, all the staff members. It's all of that really is keen to me to keep going and keep going back to that resource. It's an easy access resource is the other thing. It's easy to access. People know all about it, and I think the evidence there is even just with the the acronym FAST. Look how well it's taken on now, and people are learning so much about that through FAST and acronyms like that.
You must have seen the agenda for today. You must know what's coming next. Thank you so much, Donna, for speaking with us. Is there anything else you want to say?
Well, I believe 100% that there's huge applicability for Heart and Stroke to continue on with the virtual patient visits. I think it's one way for patients and their families to get connected, but also stay connected is the huge part. So I think there's huge applicability for this. Thank you for asking me to come.
Thank you for watching this episode of Healthcare Insights during COVID-19. You can find more virtual care resources for both healthcare providers and patients and caregivers at strokebestpractices.ca. To learn more about how systems of care have adapted to meet the needs of people and families, listen to our new podcast series that features leading experts from across Canada. If you are looking to connect with others living with heart disease and stroke, join our online peer support communities. Here you can ask questions, receive support, and get practical advice in a safe environment. Take good care.